So should I be bold enough to say that some people are misdiagnosing and therefore mistreating what they feel is a migraine?
Definitely. A lot of people misdiagnose and they self-diagnose, self-treat, and we mentioned earlier the cluster headache. Cluster headache also presents typically as a one-sided headache. There are some other more, I will not bore you with their names. But in the
picture there, it was around the eye. Is this, for example, now, is it a rough guide of what a person can expect, and therefore at least be able to, if not diagnose, at least describe the type of headache they're having to a doctor, that the thing just seems to be behind my eyes, like someone's hitting me in there with a knife or something like that, or it just like a drum is pounding in my head, that kind of thing.
Okay, well, you're talking about cluster headache.
Yes.
Yeah, the thing is that the cluster headache is very rare, okay? But when people have it, they typically get treated for a migraine, and they realize that their migraine is not going. But it can be so disturbing, and there are even some people that who prefer to just have their head cut off. And they can come and say, "Doctor, please cut my head."
Have you heard anybody say that to you?
Oh, yes. Yes. As in, that whenever they are having the headache, they just wish that
the head could just come off.
Somebody could just chop the head off. And in fact, cluster headache is one of the reasons why some people commit suicide. It looks very simple, but people can commit suicide.
Does it then alter brain processes? Does it make the person think differently? Does it make him change from who he actually is? Because for someone to want to commit suicide, he has to have some thoughts, feelings that are odd, that are different from the normal.
Well, I can't say exactly, but it's like it can be a bit impulsive, because there are some of these headaches, cluster headache, for example, it can give you such an excruciating pain. You think like the world needs to end for you there and then.
That is terrible.
Some patients that I've seen have given that kind of complaint. Fortunately, it's even treatable. But the thing is that when they get the wrong treatment, because they are not seeking the right, it's not clearly described, or one is not identified, they are just suffering unnecessarily.
Okay, I know that there's a lot of pain involved in these headaches, but are there some other symptoms that make the person's life disabled, sort of? Because, in the intro, it describes headache as reducing quality of life. Apart from pain, are there other things?
Okay, well, we seem to be focusing a lot on the primary headaches. The thing is that in the primary headaches, when they are not getting the right treatment, it's especially when the headache continues, it can really disable them. They are unable to focus at work. They are unable to do the normal things. Sometimes, like the migraines and some of this type of headache, they make you vomit. You prefer to stay in a dark, quiet room, because even light or noise can really make you feel worse. So it can prevent you from doing your normal work. And in some people have even lost their jobs because they are not able to produce. They are not optimally, So it can really be a nuisance to a lot of people.
Okay, so when would you say is the right time for someone to seek medical assistance? Okay,
the right time to seek medical assistance is when we have a reason to suspect any secondary headache. Okay. So if there's headache with any other thing, it's important to try and seek help. Okay. Headache like weakness of one side of your body, headache and fever could be the beginning of a more serious condition. I know that we frequently just take, once we have a headache, fever, or with or without fever, a good number of us just go to the counter, ask for anti-malaria, and start treating. And when the malaria doesn't go, you go and do blood tests, malaria, typhoid. And then the headache, or if it's due to an underlying serious condition, the underlying condition keeps building up. And then after weeks to months, then you now decide to see the right person.
But weeks to months may be too late.
It may be too late, yes. There are a lot of brain tumors that present with simple headaches, and they don't seek attention on time. There are some infections of the brain, like what we call a meningitis. That's the infection of the covering around the brain. It can present with just headache. And when people start seeking the general treatment instead of seeing the right person, you delay, and it may be too late sometimes.
So the injunction to see the doctor after 2 days if symptoms persist, does it hold true for all sorts of headaches?
Well, I love the statement, if symptoms persist after 2 days. I'm one of the people that I believe that you should really do that, okay? If you hold on with something as simple as something that you think is a simple headache, you may end up finding out that it's the sign of something much more serious, and you should